Vietnam was the first country where SNV works that recorded cases of COVID-19 and started imposing restrictions from early February. We were the first country office to introduce travel restrictions and a business continuity plan. But the good news is that Vietnam is also the first country where SNV works that is coming back out of the crisis and where work is starting to go back to normal. The Prime Minister of Vietnam declared COVID-19 an epidemic on the 1st of February, and restrictions started being put in place from that date onwards. The restrictions have finally largely been lifted from the 22nd of April. But of course, the economic and social impacts of the restrictions and the potential that the pandemic will come back to haunt Vietnam are still big challenges that face the country. The lockdown measures, which in Vietnam have been called social distancing measures, and trade restrictions have caused significant unemployment, the bankruptcy of many SMEs, and economic hardships, especially for the poorest and the most vulnerable segments of society. At SNV, with most staff and our partners working from home, we adjusted project activities and changed the way we worked so that we could protect the health of our staff and protect the livelihoods and health of the communities we serve.
When the pandemic happened, the city was locked down, travel meetings were restricted. So the team had to change our original plan.
We had to adjust not only the working style but also actions during the pandemic at different level. At grassroots level, we provided updates, the latest news about the pandemic through diversifying communication channel, ensuring that 100% of people in our targeted community in remote area be aware of the pandemic, know how dangerous it is and what to do to prevent it.
Due to the travel restriction, our agriculture extension officer couldn't go to the field for monitoring the technology activities as per usual.
We prioritized our work and pushed some of the stuff from field work to our desktop analysis. This way we could keep momentum.
Look into our annual work plan and do everything remotely.
We switched to communicating on our tasks, assignments and updates through email and communication technology.
We held a lot more video calls, so we're doing a lot more communication to make sure that people know that we're active and helping them.
So instead of providing on-site training, we devoted more time and effort for online training.
And with the bioregisters in the country, we normally have to physically verify them. With the virus, however, having physical verifications taking place is becoming a bit of a challenge because people don't want you at the households to reduce the risk of contracting the disease. And also the quality control teams do not want to go into the field and put themselves in an unnecessary risk. So to go around this issue, both SNV and our donor have helped and supported those quality control teams by endorsing the idea of conducting phone verifications instead of physical verification.
And we are now also starting with the local partner to develop an additional activity for support SME, the cooperative, on e-commerce, on new technology and new product for them to access the market.
We conducted phone surveys with the biogas enterprises to assess the impact that the coronavirus has had on their markets.
Thank you to the government and to the people of Vietnam for their really impressive and effective response to COVID-19. And our partners for the truly amazing job they've done to keep our projects on track as much as possible so that the hardships for the communities we work with and the SMEs that we support are kept to a minimum.